We're always told to check for lumps. But what if some of the most important signs of breast cancer weren't something you feel, but something you could actually see? Today, we're going to take a closer look at those visual signs, especially on skin tones that are so often left out of medical textbooks. Let's dive in.
Seriously, take a second and think about that. If you looked in the mirror tomorrow, besides a lump, would you really know what to look for? If the answer is, I'm not so sure, hey, you are definitely not alone. And that's exactly what we're going to tackle right now.
And this is the heart of the problem. For generations, the medical textbooks and diagrams we've all seen have had this massive blind spot. By almost exclusively showing symptoms on light skin, they've created a really dangerous knowledge gap. I mean, think about it. If you've never been shown what to look for on your own skin, how are you supposed to recognize it?
All right, so let's fix that. We're going to start with a guided tour of the breast self-exam. We're going to really focus on what you can see right in your own home. And this isn't just about throwing facts at you. It's about giving you the tools to be your own biggest health advocate.
A self-exam really boils down to two key parts, looking and feeling. Now, both are super important, but we're going to zero in on the visual check today. Why? Because what you can see is so often the most overlooked piece of the entire puzzle.
Okay, so the first sign to look for is skin dimpling or puckering. The best way to picture this is to imagine a tiny little anchor underneath the skin. If a tumor starts to grow, it can actually pull the skin down with it, creating a small indentation. It might not be super obvious at first, but it's a critical sign that something's changing underneath the surface.
Next up, nipple retraction. This is when a tumor develops behind the nipple and starts to pull it inward. Now, the key word here is change. Look, if your nipple has always been inverted, that's just your normal. But if you notice a new inversion, where it suddenly starts turning inward, that's definitely a sign you need to get checked out.
This next one is a really specific change in skin texture. It's often called peau d'orange, which is just French for orange peel skin. And honestly, that's exactly what it can look like. This happens when a tumor blocks the flow of lymph fluid, causing the skin to swell up and get thick and pitted. This can be a sign of inflammatory breast cancer, which is rare but aggressive, so it's a really important one to recognize.
This quote, wow, it just says everything, doesn't it? We've been so trained to only think about lumps that we often forget to simply look. But your eyes can be one of your most powerful tools for early detection. Just knowing what to look for is a massive first step. So, we've seen the signs on the surface. Now, let's go a little deeper. Let's peel back the layers and see what's actually happening inside the breast to cause all these changes.
To really get what goes wrong, we first have to understand what's in there to begin with. The breast is this complex mix of skin, fat, and the mammary gland. And it's way down inside that gland in this tiny little network of milk ducts and lobules that most breast cancers get their start.
So, the most common type of breast cancer is called ductal carcinoma. And yeah, you guessed it. As the name implies, it starts right there, inside those milk ducts. This slide gives you a perfect picture of what's going on. On the left, that's a healthy, clear duct, an open channel. But look at the right. Cancer cells have started growing, basically clogging up the works and forming a tumor. And this is the critical point where that cancer can break out and start to spread.
Okay, so let's say you've noticed a change. You've done the right thing, you've gone to the doctor. What happens next? Let's walk through that path from just a suspicion to a real diagnosis. Usually, the journey starts with some kind of imaging, like a mammogram or an ultrasound, just to get a better look at what's going on inside. But pictures alone can't give the final answer. The only way to know for 100% sure that it's cancer is with a biopsy, where a tiny piece of tissue is examined under a microscope. Once cancer is confirmed, the next big question is, how far has it spread? This is called staging, and a good way to think about it is like this. Stage 0 is like a seed that sprouted, but it's still inside its little pot. For stages 1 to 3, the roots are starting to spread out into the nearby garden. And stage 4 is when the seeds have been carried by the wind to completely different parts of the yard.
And remember that ductal carcinoma we saw earlier, the one that kicks off in the milk ducts? Well, it's not just a type of breast cancer, it is the most common type, making up about 80% of all cases. And that's exactly why knowing everything we've talked about today is so vital.
Now that we've gone through the science, let's bring it all the way back to where we started. Why is it so fundamentally important that we see ourselves, all of ourselves, in these medical images and diagrams?
Because when you can actually see yourself in medical information, it does way more than just educate you. It empowers you. It gives you the confidence to speak up, to ask the tough questions, and to demand better care. It's such a simple change, but it can have a profound impact on health outcomes for absolutely everyone.
We've focused on breast cancer today, but really, this is just one piece of a much, much bigger puzzle. It makes you wonder, right? Where else in medicine are we failing to see the full picture? What other conditions are being missed or misdiagnosed, all because of this one blind spot? It's a huge question that affects all of us, and it's one we need to keep asking.